Yeah, hypertension or high blood pressure is one of the commonest chronic medical condition. It's seen throughout the world. So if it actually affects more than 1/3 of your global population. So when do we call hypertension or high blood pressure? In a normal person, the blood pressure is usually it is around a range of 120 by 80 millimeter mercury. So that has two components. One we know as the systolic component and the diastolic component. The systolic component means the blood pressure soon after your heart contracts, and the diastolic blood pressure means the blood pressure while in your heart in a relaxed state. So the systolic blood pressure is around 120 and the diastolic blood pressure is around 80 millimeter mercury. So that is the normal blood pressure. So your blood pressure is persistently above 140 millimeter mercury systolic, or your diastolic blood pressure is more than 90 in the diastolic phase, so then we call it high blood pressure. Risk factors for you to develop high blood pressure is mainly the age is one of the main risk factors. So as we get older, so there is stiffness in our blood vessels, so there is blood pressure tends to rise with age. So after the age of 40, people usually develop their blood pressure slightly going up. So age is one of the main risk factors. Then the genetic factors is important. So if you have a strong family history of high blood pressure, the likelihood of getting high blood pressure is also high. Second, other important risk factors, maybe lifestyle related risk factors. So if your diet containing excessive salt, so if you drink too much alcohol, so those are also important risk factors for high blood pressure. And again, certain disease conditions. So if you have kidney disease, or sometimes your body produces certain excess hormones, then your blood pressure can go up. So these are some of the important risk factors and causes for high blood pressure. Yes, so when it comes to symptoms of high blood pressure, it's not like other conditions. So most of the time, the high blood pressure itself doesn't give rise any symptoms. So that means most people with high blood pressure do not have any symptoms. So they just go to a doctor for some other reason and they are found to have high blood pressure. So it's basically asymptomatic most of the times, unless your blood pressure is very high. For example, if your blood pressure is above 180 or diastolic blood pressure above 120, you may have symptoms like chest pains, difficulty breathing, or headaches, or sometimes you can have visual disturbances. So those symptoms are usually seen with very high blood pressures, but otherwise most people do not manifest any symptoms. So that's why it's very important to get yourself screened for high blood pressure, particularly if you have risk factors. So when you have high blood pressure for a longer time, so it will affect your cardiovascular health. So if your blood pressure had been high for many years, so the risk of you getting heart attacks and strokes are much higher than people who do not have high blood pressure. So the other problem of having long-term high blood pressure is it can also affect your heart it can cause structural changes in your heart, so that your heart becomes weaker on a long term, and then you may go into heart failure. So that is why it's important to control your blood pressure. So that is one of the cardiovascular complications, and some people with kidney diseases also have high blood pressures. In those patients, the high blood pressure, particularly if it is uncontrolled, can lead to progression of their kidney disease, so that they can end up having end-stage kidney diseases. Once you have been diagnosed to have high blood pressure, it is important to understand that high blood pressure is a chronic condition, and it is going to be, most of the times, it's going to be there for your lifetime. So it is important to learn to live with that, and to have a regular follow-up with your physicians, and to get your blood pressure under control. So when we talk about blood pressure control, most people need to have their blood pressure goal of keeping it under 140 by 90 millimeter mercury. And some patients, particularly patients who are already having heart disease, chronic kidney disease, or diabetes, so their blood pressure targets are actually lower than other people. So they should maintain their blood pressure ideally below 130 by 80 millimeter mercury. So how do we achieve that? So the mainstay of treatment, before we talk about medications, so it is important to modify your lifestyle and the risk factors associated with high blood pressure. For example, if you are overweight, so you need to lose weight. So you have to make yourself more physically active. Then your diet should contain less salt, and if you are drinking too much alcohol, it is important to reduce or cut down the amount of alcohol you drink. So those lifestyle changes will have a significant impact in your blood pressure control. In addition, your physician will decide to start you on blood pressure lowering medications. We have many types of blood pressure lowering medications, and your physician will decide which type of blood pressure medication most suit yourself. So then it's important to have a regular follow-up with your physician, and to achieve the blood pressure targets, which will help you to minimize the complications associated with high blood pressure.